All right, if you're a dog owner, you know that amazing feeling, a happy greeting from your best friend. But let's be honest, sometimes that greeting comes with, well, something a little extra. You know the moment, right? You lean in for a cuddle, and bam, you're hit with this wave of not so pleasant breath. It's a moment pretty much every single dog owner has had. And you're definitely not alone in that. But here's the thing. What we often just brush off as doggy breath is actually a sign we really shouldn't ignore. A healthy dog's mouth, it shouldn't really have a strong smell at all. So, in the next few minutes, we're going to dive in and explore what that smell is really trying to tell you. And more importantly, we'll cover the simple steps you can take to protect your best friend's health. Okay, let's start with a number that honestly might shock you a little. 80%. That's right, 80% of dogs show signs of dental disease by the time they're just 3 years old. That's 4 out of every 5 dogs. This really shows us it's not some old dog problem. It can start really, really early. So what does that bad breath really mean? Let's get right into it. It is so much more than just a bad smell. So the medical term for this is halitosis. But here's the key takeaway, the most important thing to remember. Halitosis isn't a disease itself. Think of it more like a big, flashing red light. It's a symptom that something else is going on inside your dog's mouth, or even their body. And you guessed it, the #1 cause of that flashing red light? It's dental disease. So let's walk through how a perfectly healthy mouth starts to head in the wrong direction. Okay, so it all kicks off with plaque, that invisible sticky film of bacteria that, we get on our teeth too. Now, if that plaque isn't brushed away, it starts to mineralize and harden into tartar. And tartar is like concrete for bacteria. It's tough stuff. This buildup right at the gum line causes the gums to get red and swollen. That's called gingivitis. And if we let it go, the bacteria work their way deeper, damaging the very structures that hold those teeth in place. And that's periodontal disease. And this is why we take dental health so seriously. The problem doesn't just stay in the mouth. I mean, sure, in the mouth, it can cause a lot of pain, tooth loss, even infections in the jawbone. But what's really concerning is that the bacteria from an infected mouth can actually get into the bloodstream. And from there, they can travel and pose a risk to vital organs like the heart, the kidneys, and the liver. It's the perfect example of how oral health is truly whole body health. Now, while dental disease is by far the most common culprit, sometimes your dog's breath is telling a completely different story. Certain really distinct smells can be clues to other serious health problems. This is where you get to put on your detective hat. So, if their breath has a distinctly sweet or fruity smell, that could be a red flag for diabetes. If it smells kind of like urine or ammonia, that can point towards kidney disease. And an unusually foul, almost rancid odor might signal liver issues or, in some cases, an oral tumor. The big takeaway here is if you notice any of these specific smells, that's your cue to call your vet right away. Okay, so beyond just the smell, there are a bunch of physical signs you can actually look for at home. This is all about you becoming a detective for your dog's oral health. So, next time your dog is relaxed, try to gently lift their lip and take a look. What are you looking for? Well, any yellow or brown tartar buildup on the teeth? Check out the gums. Are they a nice, healthy pink, or are they looking red, swollen, maybe even bleeding a little? Then just pay attention to their behavior. Are they drooling more than usual? Chewing only on one side of their mouth? Maybe dropping food when they eat? These are all classic signs that their mouth is hurting them. All right, so let's say you've noticed some of these signs and you've made an appointment with your vet. Great job. But what happens next? Let's kind of pull back the curtain on what a dental checkup actually looks like so you know exactly what to expect. First, your vet will do a conscious oral exam, basically a first look while your dog is awake. They'll also ask you a bunch of questions about what you've been seeing at home. They'll probably recommend some blood tests, and these are super important for checking their overall health and making sure anesthesia would be safe for them. Because really, the most thorough work has to happen while your dog is safely under anesthesia. That's the only way we can do a deep cleaning, get in there and scale the teeth, and take x-rays to see what's happening below the gum line, which is where a lot of the problems hide. Okay, we've talked a lot about the problems. Now let's switch gears and talk about the single most powerful tool we have in our arsenal: prevention. I know, it's not the most glamorous job, but it is, without a doubt, the single most effective thing you can do at home. Daily toothbrushing really is the gold standard. It's all about removing that first layer of plaque before it gets a chance to harden into tartar. So here's your home care toolkit for success. First, a dog-specific toothbrush and toothpaste. And please, Never use human toothpaste. It can actually be toxic to them. You can also supplement brushing with things like dental chews, water additives, or even special dental-focused diets. Here's a pro tip. Look for the VOH seal of approval on any products you buy. That stands for the Veterinary Oral Health Council, and that seal means the product has been scientifically proven to be effective. It takes the guesswork out of it. Because when it really comes down to it, taking care of their teeth isn't just about getting rid of bad breath. It's about preventing chronic pain and protecting their overall health. And that's a huge part of giving them a long, happy life with you. So I'm going to leave you with this one question to think about. The next time you lean in and get a whiff of that doggy breath, I hope you'll just pause for a second and ask yourself, is this just how dogs are? Or is my best friend trying to tell me something important? Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.